Good afternoon, Chris. This is Dr. Chris Lowthert, and Chris and I are now into our second conversation on German New Medicine. And welcome, Chris. And
Hello.
if you could take it away.
Well, thank you, Kathleen. It's great to be back. I thought our last conversation went really well, and I hope to build on that this time around. I thought after our last conversation that it would be good to, let's say, build the foundation, and a solid foundation, which is the 5 biological laws. I did touch upon them a little bit, but in a more overall scheme last time. So this time I really want to go through all 5 biological laws that were discovered by Dr. Rieker Geerdhammer, and it's known as German New Medicine. So that's my intention today.
That sounds great, Chris. And I wanted to also say that I have on my end have had tremendous feedback, so positive from all over the country and across the world as well.
Yes.
So I'm primed and ready, and as many others are. So thank you, and the floor is yours.
Excellent, excellent. Well, I really wanted to start out by just again with a few propositions or questions, so to speak, right? Are they symptoms of healing or symptoms of illness is one thing that I often discuss with folks. Are our symptoms that we experience on occasional basis, or some people on a regular basis, are these symptoms indicative of an illness or a sickness, or can they really be actually symptoms of healing, symptoms of the body's way of healing, right? So I want to get into that a little bit deeper today. And I also want to again begin with the big picture of what Dr. Hammer has given us in the sense of what he has done to the current paradigm of disease and how he has flipped it on its head. All right. So I said last time, I said, what if every so-called disease has a meaningful biological purpose that actually assists us or supports us in dealing with unexpected emotional distressing situations? And this meaningful biological purpose is based on the biological function of that particular organ that was involved, right? And so we then looked a little bit further, and we started to discuss what I like to talk about is our biology and our biography, looking at our life story, and we can reflect on our story, our life story, and look at certain experiences in our life, and also look at what was happening biologically speaking, what symptoms were going on at a particular point in our lifetime. And this is a very common introspection that happens when people first get introduced to German New Medicine. They start having these moments of, aha, wait a minute, I remember going through this certain experience and then developing these certain symptoms, right? And so, as in Dr. Hammer's story, where he lost his son, and then several months later, he was diagnosed with testicular cancer, okay? And so Dr. Hammer was, when he began looking into the psyche and the role of the psyche, he also looked at the brain. And at that time, in the early 80s, the CT brain scan was being widely used. And the CT brain scan basically takes slices of images of the brain, different slices at different levels of the brain. And what he started to notice was there were certain brain scans that were showing either concentric rings in the brain scan or areas of increased density, right? Now, in the brain scan, what Dr. Hammer found was that, and this was obvious at the time, and I mean, even a 10-year-old will know this, is that the brain does control everything that's going on in the body. So why wouldn't the brain have certain areas of in the specific areas of the brain that correlate to specific areas of the body? And that's exactly what Dr. Hammer began to do. He began to map out the brain at the same time listening to his patient's personal history, identifying certain unexpected traumatic events or unexpected distressing events, and then correlating it to what the brain was showing in the CT scan. Now, when a person just experiences an unexpected shock, it's literally visible on the brain scan as concentric rings. And I'm hoping in the future talks, we'll be able to show some of these images, but you can go to learninggnm.com and see these images of the brain scan. But literally, he started to see these concentric rings on different areas of the brain. And it almost looked like somebody dropped a pebble in the water, right? You see these concentric rings. What he found was the brain scan would actually show when the person was either in the conflict active phase, meaning they were in that distressful situation at that moment of the imaging of the brain, indicated by the concentric rings, or when the person moves into a natural healing, then what he started to find was different areas of density changes in the brain, darker areas, and then eventually whitened areas, okay? I'm going to kind of keep it at that right now in the sense, because we're going to go a little deeper into what he discovered with the role of the brain. But I know last time we spoke a lot about the psyche, and that's just one of the three components. What he found is that the psyche, brain, and organ operate synchronistically in this special biological program. Okay. And so he was able to, like I said, map out the brain, find that certain areas of the brain correlate to certain organs of the body, confirm it with the personal history. And this is how he got the big picture. Okay. Now, what we can do now is go into the 5 biological laws. Okay. And I apologize. I'm a little scattered here because I'm presenting in a way that I wasn't yet prepared for, but trust me, this is an unexpected shock for me. We'll be able to roll with this. I want to get into a little bit details of the 5 biological laws that Dr. Hammer found. The first biological law is that all so-called disease is initiated by an unexpected, distressing experience. Something that catches us off guard. Something that comes out of the blue that we weren't prepared for. It's a highly subjective event. And so me and you can experience the same shocking event and perceive it in a different way, which would then manifest differently in our bodies as we heal. And so there's 2 aspects that make up a biological shock. And that is that it's unexpected and it's subjective. The second biological law is that the special biological program that was activated by this unexpected distress runs in 2 phases. There is what we call the conflict active phase, and then there's the healing phase. And the healing phase only gets initiated once the psyche resolves the conflict.
Mhm.
Okay. And so we can see that it starts in the psyche, and then it first and foremost has to heal in the psyche, and then the body comes along, right? And so it runs in this two-phase pattern, and this two-phase pattern is directly related to our autonomic nervous system. And so when we're in the conflict active phase, our nervous system gets elevated, and we call it sympathicatonia. And so just simply stating, our sympathetic nervous system is activated. And so there are certain signs and symptoms that we can begin to recognize that indicate that we're in conflict activity. First is our hands get cold, our extremities get cold because of the sympathicatonia causes our vascular system to contract, and so our extremities get cold. And so one of the simplest ways as practitioners of determining where a patient is in this program is to just touch their hands, right? And so not only is it reassuring to the patient when physical touch is happening, but the doctor or the practitioner gets an idea where they're at, right? We've all felt this before. We all know this feeling of these cold hands.
Mhm.
Another symptom is a lack of appetite. We lose our appetite when we're conflict active. Our body's not ready to digest any food. It's not in a state of digestion, right? Right now it's in this heightened state of awareness and activity where it's preoccupied with this unexpected shock that just occurred. And so we lose our appetite. Depending on the intensity of the conflict, that appetite could diminish altogether and we start losing weight. Cachexia is the medical terminology. People start to waste away.
How do you spell that, Chris?
Oh, I knew you were going to ask me that. Cachexia. Oh, geez. I'm not very good at that. I'll get back to you, okay?
No problem. No
Okay.
problem. I
Yeah.
wanted to.
So it's just the losing of weight, unexpected weight loss, right? We hear this in the cancer world, right? Have you unexpectedly lost weight? And people, yes, I am. I'm losing weight. I don't know what's wrong. I don't have an appetite. I don't eat anymore, right?
Mhm.
Another symptom is more at the psyche level, is that we're preoccupied with the distress, which then causes sleep disturbances. And so we might have trouble falling asleep at night because our mind is continually racing through the distressful situation. Sometimes we're so exhausted that we fall asleep, and then we wake up at 1, 2 o'clock in the morning, and boom, there it is, that preoccupying thoughts, right? And there's a biological there's a purpose for this. These sleepless nights. It's to give us more time in the day to resolve the conflict. It puts us in an advantageous situation so that we can work through this distressful experience, okay?
That's quite beautiful.
Yeah, it is. It's amazing. Again, it supports us. It supports us in these unexpected moments. And so when we wake up at night and we're thinking about whatever that is, that's an opportunity to focus in. What do we have to do? What do we have to do? Right?
So rather than looking at it and finding more stress in the fact that, oh, I'm not sleeping, and I'm going to be tired tomorrow, we can embrace it and look at it as a gift from our body's wisdom and say,
Sure.
okay, I'm awake. Here's more time to work out and understand the conflict that's in the psyche.
Certainly.
I've never looked at it that way. It's a beautiful
Right.
awareness.
It turns this whole insomnia issue into a meaningful experience, right?
Yes,
It's not just another label
yes,
that
it's
is
lovely.
placed upon people that they're dysfunctional, they can't sleep, and so we give them sleep aids, right?
Right.
Knock them out.
And it causes then additional stress, and that stress is essentially made up. And there's no solution for that other than going back to the core. So if we don't add all these silly things on top of a very natural and healing function, we do much better.
That's right.
I like
That's right. Imagine that, right? Imagine that. So again, the power of this knowledge is the recognition of where we're at, what's going on, what does the symptoms mean? And so right here, we just covered the very common symptoms that we can now take with us the rest of our lives. And that when we are experiencing those symptoms, we know that we are in the conflict active phase. And that the objective, the aim, the purpose of the conflict activity is to find resolution to the conflict. And this is something we can explore later on, is the practical applications now of this knowledge. Is how do we resolve? What do we do to resolve conflicts is a very common question I get. But again, just as the conflict shock itself was subjective, the resolution is also subjective, right? And we will all discover that in our own, that resolution in our own unique way based on who we are and the tools we have. But again, it's putting back, have confidence in oneself now, that we know what we're going through and that we will come to resolution if we have to.
So Chris, would you say, I mean, I think we talked about this last week, is that we all have experiences in our lives that are shocks.
Sure.
That's unavoidable. And so basically what I'm hearing you say is that the body is prepared for that. The
Absolutely.
body has this
Absolutely.
system.
Yep.
And it recognizes this shock and this subjective, unexpected shock. And it says, here, man, here, woman, here, child, just listen, pay attention, and you can resolve this by understanding the conflict. So we have everything right there in front of us, and to not be concerned, but to actively go about seriously resolving it.
Sure. And again, you know, this is a subjective experience, this resolution. And Dr. Hammer has told us that sometimes there are certain conflicts that can't be resolved. And that's okay also. And so we don't want to get too hung up at times with the resolution of our conflicts, right? But that there may be some conflicts, as he said, that we take to our grave. And that's okay too. It's just it's the recognition of these conflicts that is very powerful medicine. And that gives us a basis of navigating, right? And so one of the things we talk about often is that sometimes it's just a matter of downgrading our conflicts. We might not necessarily be able to resolve it due to circumstances, right? But what we do have in our power, in our control, is that we can downgrade our situation. And downgrading, again, is another unique way people can explore in how they handle things. And so if we downgrade, the power of downgrading now is that sympathetic, that lasting sympathetic stress that we're going through starts to decrease. And that slows down the physical changes that are taking place at the organ level, which we'll get to. And those physical changes now, there won't be as much to heal if indeed the resolution comes back. So, and this will become a little clear as we go on to our next biological law. But let's just put that keep that there, this idea of resolution and downgrading, and that the two phases is based on the unexpected shock, which we call a DHS, or a Dirk-Hammer syndrome, in honor of Dr. Hammer's son. The DHS initiates the program, starts the program, and then healing is initiated once the conflict is resolved. Okay, that's the basic explanation for the two phases. Now, to get into the second phase, the healing phase, and talk a little bit about symptoms that we can become aware of, is that when the body begins to heal in the healing phase, our nervous system starts to downregulate, right? The parasympathetic nervous system becomes more pronounced, and we call this vagatonia. And now the person starts to experience fatigue, tiredness, unable to get out of bed, maybe because the fatigue is so extreme, right? So severe. They may begin to feel some pain, discomfort in areas of their body that is healing. They may develop a cough or a stuffy nose. So there'll be some inflammation in the healing phase, right? There may be headaches in the healing phase, where the area of the brain that controls that particular organ begins to heal. And so on the brain level, the healing is experienced with increased edema or swelling at the brain level, causing headaches, dizziness, right? And we may have those hot spots on our head where we feel that healing taking place, right? And so we can simply put some ice packs on our head to help with the healing at the brain level. You see, once the resolution happens, it happens in the psyche first and foremost, but then it also simultaneously begins to heal at the brain level and at the organ level. And so there will be inflammation, fluid at the organ level, which will create some pain, discomfort. All right. And so healing always takes place in a fluid environment.
Yes.
Healing always takes place in a fluid environment. The body knows this, and we can observe this in our own body. Now, one an analogy that we can think about to kind of get a little bit more comfortable with these healing symptoms, is that we think about when we fall off our bike when we were little and we scrape up our knee really bad, and there's a lot of blood and pus and inflammation and it hurts. Well, we can see that. And so we tend to that wound, right? And we know that if we just take care of that wound and allow it to heal, maybe not use it, maybe we can't get back on our bike for a couple days because we can't move our knee because of the pain. And then we just watch that scab form. We can see the beauty of the natural healing that's taking place with that wound. Well, the same thing happens internally. But most importantly, the wound on the psyche is healing. And so oftentimes what we find in folks is that scab, that scar, that scabbing, that healing wound of the knee opens back up, and there's a prolonged, it prolongs the healing phase, right? We might open up that scab and it starts to bleed and it still has a little longer to heal. Well, oftentimes the wound in our psyche is opened back up because we come in contact with the individual that's connected with the original conflict, or that situation continues to kind of flare up, let's say, right? And so people will get what we call a hanging healing, where they have a chronic symptom, right? The symptom of chronic symptoms of fatigue or chronic symptoms of pain that kind of go and flare up, right? You see this often in chiropractic work. They have flare-ups. Well, this means that they came in contact or had a relapse, let's say, or a trigger, something triggered them to experience the conflict over again, right? Do you follow what I'm saying here?
I do, but what comes up to me is that perhaps the resolution of the initial shock in the psyche was not completely resolved.
That's right.
When there is a complete resolution, then the healing can just be very complete and very smooth and rather rapid. And that was my own experience.
Here
So
we go.
I find it fascinating because I've had this experience, and
Sure.
it's true to everything you're saying.
Yep. So you're right. There may not have been a complete resolution, but enough of a resolution to give that body to get into that healing phase, right? So when we know this now, and we know that we are experiencing a chronic symptom, we know that, as you said beautifully, that the resolution wasn't completed just yet. So we go back and see what we can do to complete that process so that we can allow the program to finish, right?
It's like we're given these many opportunities. It's never too late. We can go back, we can correct, we can adjust, we can modify, and then the body just goes on its way to healing. I mean, it's the most gentle and beautiful system that we have, that we embody.
Yeah. And this is just as German medicine. It's a system of medicine that is directly connected to our innate healing. And for the first time ever, we have a compass that guides us, directs us to where we're at, to show us where we're at in this, right? And
Well,
gives, as you said, an opportunity, right? An opportunity.
you know, I've wondered about that. I think about it as being that we've always embodied this system. So it's the German New Medicine discovery of the ancients, of the old ways, of the time when we were totally connected to nature, connected to ourselves. Because what I understand you talking about is a recognition and an understanding of a fully integrated body system and of psyche, mind, and the physical organs. And that takes a very sophisticated integration, which we've been drawn away from, right?
Right. We've been drawn away from that connection to nature. And so, yes, that it is old, and at the same time, it is new. Dr. Hammer gives us an explanation as to why we develop colon cancer and not diabetes. Why do we develop a brain tumor? Why do we develop a stuffy nose and a cough, right? Why do we develop it at that particular time in our life, right? Why somebody gets back pain? What is the emotional component, right? What's the emotional component to our back pain? Well, Dr. Hammer found that low back pain is a self-devaluation conflict, feeling self-devalued, and even further, feeling unsupported.
Mhm.
And so people that come into the office that have low back pain, I know that they have experienced a feeling of unsupportedness.
Mhm.
But yet, because they're in pain, I know also that they're in healing.
Mhm.
And so what do? Just as times of old, we create a supportive environment around that individual, free of fear and panic, and allow the symptoms to run their course undisturbed, right? That's what we did in the past. And that's what we can continue to bring with us with this new medicine. So you're absolutely correct. There is an aspect of this innate healing, obviously, that is old and was recognized. But then there's this whole new frontier now that can be explored by all ways, let's say, alternative practitioners, right? This is the new foundation we can build on with chiropractic or with herbalism. I mean, just herbalism itself, in such an ancient modality, an ancient body of knowledge, right? Anecdotal evidence that, yeah, now we have, for the first time ever, a new framework to work with these herbs. Why do these herbs work? Well, I'll kind of touch you real quickly because it's part of this two-phase response in the role of the autonomic nervous system. There's certain herbs that help us calm down, right? So if we're in conflict activity, we can take certain herbs to help us downgrade the conflict. And then there's certain herbs that we can take in the healing phase that supports the healing, not disrupt the healing. And so there's a whole vast, I mean, this is the exciting part about German medicine and all these different modalities that we have, right?
I wonder how much Dr. Hammer drew from the herbalists of the past, and because they innately understood this. I mean, valerian roots, very old, and St. John's wort and catnip and chamomile, and I mean, there's so many herbs that they've been used for centuries and centuries, and I wonder how much of this he intuited, how much of it he understood. Do you have insights?
I don't know how much he knew about that, but I would say, because he was a genius, and he had a vast knowledge of so many different aspects of our lives, right? And so I'm sure he respected the herbalism of the past, right? And so, yeah, that's a good question. What did he know, right? That kind of supported him as he made these discoveries, right?
Yeah.
Kind of nudged him in the right direction, because again, he's coming from an allopathic training, right?
Right. And of course, Chinese medicine,
Another one, yeah.
Very, very old, and Ayurvedic medicine. I mean, but Chinese medicine has a very strong connection to the emotions and the understanding the organs and the emotional happenings within the organs, and then the body points. So
Absolutely. So this is a whole new frontier that we can all explore together based on what we bring to the table as practitioners, right? This is an amazing opportunity for us to collaborate and to explore, but outside of the disease paradigm, in this new paradigm of the special biological programs, right?
And at a time in history when becoming empowered is so important.
Sure. Yeah.
And choosing a modality or methodology that is completely healing and not toxic. So and something that we can do basically ourselves.
That's right.
And
That's right.
and that's not going to break our financial situation.
Here we go. Right.
So the independence, the freedom, the sense of our magnificence as our body, as our, your individual person, my individual person, each person has this capacity. And to recognize it now, particularly now in 2021, under the circumstances we find ourselves, it's like the most beautiful gift we could possibly explore.
It's true freedom. It's true freedom. You don't need anything. You just need the knowledge. You need the German New Medicine knowledge. But if you choose, you can go about healing without anything other than knowing the role of the psyche.
And trusting in oneself.
Yeah, trusting in oneself, have confidence in oneself. Yeah, sure.
Yeah.
And so this is something we can explore later with the practical applications of German New Medicine now, because it kind of goes back to what you just said about, did Dr. Hammer, was he aware of all these natural remedies? I'm sure he was, but I have a sense that he would say that, "Meh, you don't need them. You don't need them, right?"
Well, there was a moment many decades ago when I was reading someone's palm, and they said, it's like anyone who's using any of these metaphysical methodologies. You don't need any of those tricks because it's all a very intuitive process, and you just have to connect in with yourself. And she was German, and I wonder if she knew about German New Medicine.
I'm sure.
Well, Chris, we are at a point now where
Oh, Kathleen, actually, before
a quote.
I'm gonna keep on going. I'm feeling that we got to keep on going here.
Okay.
I got this covered. We talked earlier, but let me just keep on going here because I want to get to the remaining two most important. I got we covered 1 and 2 of the biological laws, right? The unexpected shock, the 2 phases of all disease, so to speak, right? Now we got the role of the brain. The special biological programs are controlled by the brain. This is the third biological law. And the brain will send signals to the body, to the organ, based on the area of the brain that's involved. Okay. So in the brainstem, for example, is where our digestive system is located and controlled, our respiration and our reproduction, right? And so when the brainstem is impacted by an unexpected shock, visualized by the concentric rings, then the brain sends a signal to the intestines to increase cells in the intestines. We talked about the lungs, to increase the lung alveoli last time, right? So there's this cell proliferation is one of the signals sent from the brain. Increase cell growth, form a tumor, imagine that, form a tumor to enhance the biological functioning of that organ so that it can assist us into the resolution of the conflict. The other signal would be cell loss or necrosis, ulceration. And so we see this in the bile ducts of the liver, where in the bile ducts, when we experience a territorial anger conflict or an identity conflict, we have ulcerations that take place in the bile ducts to widen the ducts, to widen the ducts to get more flow going, right? To allow more flow, more space, more fluid, right?
For the healing.
Well, what happens then is those ulcerations have to be replenished in the healing. And so that's where we start to see the building up of the ulcerations. And so we have this process that goes on where there's either cell proliferation that happens in the conflict active phase or ulceration or necrosis, cell loss, right? And then we also have another signal where there's functional loss. And so we functionally lose maybe our sight in response to a conflict, right? But this is all controlled by the brain in the area in how the brain has been mapped out with the body and the control centers that control the rest of the body. Now the fourth one, now here's the kicker, and we're going to dance around this a little bit, because the fourth biological law is the beneficial role of microbes. The beneficial role of these invisible microorganisms. What Dr. Hammer discovered is that only in the healing phase that these microbes become known, that actually become evident. And they are specifically designed to assist us in the healing process. And so that lung tumor that formed due to a death flight conflict, once the conflict is resolved, will now become decomposed by tuberculosis, the microbacteria known as tuberculosis. And so there's fungus and microbacteria that are specifically designed to decompose the extra tissue that's no longer needed because the conflict was resolved. There's also bacteria that are designed to decompose extra tissue. But also there's certain bacteria that actually are designed to replenish those ulcerations, like in our throat, when we have a conflict where we unable to swallow something, unable to swallow a situation, an experience, and we develop the ulcerations in our throat where we start to feel a little scratchy throat. And then once the conflict is healed, the streptococcus bacteria comes around and begins to heal that area of the throat. And what are we diagnosed with? Strep throat. We have a sore throat, right?
Yeah.
And now we get to the other microbe, maybe, right? This other invisible entity that Dr. Hammer 30 years ago said that if they exist, and you know who they are,
Yes.
if these invisible entities exist, they would also assist in the healing process of the body. And you know, conventional medicine knows this to an extent. They kind of let the cat out of the bag with this. When we go back to the bile ducts, when those bile ducts are healing, what Dr. Hammer found was that if the hepatitis V is present, then the healing may be a little bit more extreme, but it will heal up. It will support the healing of that ulceration. But what he found out, interesting enough, is tissue that is involved in this biological conflict would also heal without the presence of hepatitis. And so we have in medicine right now the diagnosis of hepatitis A, hepatitis B, hepatitis C, but they also have the diagnosis of non-hepatitis A, non-hepatitis B. Well, what's that all about? Well, it's because the that so-called entity is not visible. It's not present. Well, here's the conundrum that we find ourselves in now, right? And we know if we are sharp and our probative faculty is honed in on this deceit right now, is that these entities have never been isolated. But again, German medicine, Dr. Hammer gives us, if they exist, they would have a symbiotic relationship with the body, just like all microbes do. Imagine that, a symbiotic connection with life on this planet, right? And that's the beauty of German medicine. You don't even need to get into the argument. Do they exist or not exist? Because it doesn't matter. It doesn't matter to me. It does not matter to me if they exist or not, because the body will heal anyways, with or without them.
Yeah.
And we'll get on this a little bit more maybe on another platform, so to speak, because it just blows the whole shenanigans wide open. And people ask me often, you're like, "Oh, what's your thoughts on this?" And again, it doesn't matter to me. It doesn't affect me one way or another. And this is what German New Medicine has given me and my family and friends and allies, is this indifferent stance. It doesn't matter. It doesn't matter.
Well, isn't that the beauty of it? Because there is no polarization.
No,
There
that's
is
it.
there is no fear. There's
No,
no,
there's
there,
no fear.
there's
And
no
that's what German New Medicine has given me in these 15 years. There is no fear. But there's also this recognition that there are biological conflicts happening every single day now with this deceit.
Yes,
And that's what's creating the symptoms that people are experiencing, the territorial fear, the territorial scares, the territorial anger because their businesses are closing.
yeah,
The indigestible anger that people are experiencing, the
yeah.
existence conflicts, the isolation conflicts, which is causing water retention at the organ level, which then causes complications in the healing phase. Remember, healing takes place in a fluid environment. And so if somebody has healing a territorial fear conflict on the lungs, and they have those, the areas already with fluid, and they have then an existence conflict or an abandonment conflict, as we call it, where there is more water retention now. This is what we call pneumonia.
Mhm.
Pneumonia is nothing but bronchitis, the healing of a territorial fear, combined with another unexpected shock known as an existence conflict or an isolation conflict, abandonment conflict, which creates water retention in the body in the conflict active phase. And this is what is called pneumonia. Again, we're just scratching the surface here, but when you have these lenses on now and you're starting to listen to people's stories that you're intimate with, that you know what's going on, you'll start to pick up on the conflict shocks that are happening. You'll start to hear what's going on in their lives. Now, we have to be careful because, again, a lot of this information is coming through the screen that we're talking to now, and we don't know the full story of why these people are dying, right? But again, people that are close to you, people that you have connections with, you can figure this out. I rest assure you, you will be able to identify if you have the ears and the eyes wide open, right? Now, that's the fourth biological law, the beneficial role of the microbes. And the fifth biological law is the quintessential biological law. It's the whole enchilada with salsa verde on top. It's this, all special biological programs serve a meaningful biological program, a purpose. It serves a meaningful biological purpose. These special biological laws or special biological programs are age-old survival programs that we've had in our DNA and that we share with all life on this planet. We share it with our pets. We share it with the animals in the wilderness. We have all of us on this planet share these biological programs. And not only do we as human animals experience separation conflicts, territorial anger conflicts, but so do the animals, non-human animals experience it. So it does deepen our connection to the non-human animal world when we know this medicine. And so those are the 5 biological laws, I hope, in terms that are pretty simple But like I said, we're just scratching the surface here. And I really look forward to our next conversation. So that this is what we're working with now. And I get you in the sense that there are aspects of this that are old. And yes, we need to honor and respect that. And then there's this amazing opportunity that we all have now that we can carry the rest of our lives here, right? And share with our children and apply it in our daily life every single day, right? And so with that being said, I am going to speak about children in German New Medicine. I do have a 10-year-old boy. And yeah, it's going to be that generation that's going to bring this forward, right?
Yes.
Me and you may not see it in our time, but rest assured, I'm getting a little emotional here because I know it's going to happen. German New Medicine will emerge as the new paradigm. It's already here, but it will emerge and it will be taught in the schools. And it will be passed on to generations to come. There's nothing stopping it now. They can't suppress it anymore. They can't suppress it anymore. They're not going to be able to victimize people anymore, like they victimized Dr. Hammer and lock him up. It's over. German New Medicine is here. The 5 biological laws are known and defined, and they're being passed on to the generations to come.
And I'm very grateful that you are passing this along. We're bringing this forward,
Sure.
Chris, and we're already seeing and hearing from people who are benefiting in ways that they never understood they could possibly benefit.
I think I'm getting I can really feel the emotion because I see what's happening to our children right now, with the lies and deceit.
It's horrific. They're the vulnerable ones.
They are.
And but they're also, as you say, they're the ones that will be bringing this forward because they will understand their innate gifts.
Sure. They already do.
Yes.
They come in already knowing this. They already know this knowledge. They don't have the words, but they have the instinctual wisdom with them already. They embodied as that magical child.
Yeah.
And now we have a way, parents have a way of guiding our children now, free of fear and panic.
Yes.
To allow those children to heal, which is going to have to happen as a result of what they're going through now.
Yes.
And so the quicker parents learn this medicine, the better off they will be once things start to maybe resolve for those kids. I don't know. We're in a very precarious situation right now, but all we can do is work with our children that we have, work with our friends' children, and share this knowledge with them in simplistic wording, right? And oftentimes, and I really want to say this because when children develop symptoms, they are most likely symptoms of healing. And so again, intuitively, as a mother or a father, just create that supportive environment, knowing that your child's healing, but you'll be able to recognize the vulnerability in that child's psyche to specific conflicts now, right? So if your child has chronic asthma, you know that they have a vulnerability to territorial fears and scares now because they have developed these symptoms. And so again, we can't prevent the conflicts from happening, but now as parents, we can recognize what the symptoms truly mean, and then also shed light into the vulnerability sensitivities of our child so that we can protect them and support them, and not have them carry that forth to within into adulthood now, right?
Well, I would like to encourage you to do an entire session. Let's do one on children. Not that that would necessarily be exclusive to that one conversation that we have, but let's take that one and really create.
Yeah, I really feel that that's essential right now, is that
I do too.
it's that's a good way to go. And to kind of close it up a little bit, to also some of the potential conversations, you know, diabetes, I feel, is going to be a good one to share, right? Autoimmune disease now. Hey, look at now, we have this beneficial role of microbes. What about the immune system? This is not a defense mechanism now? Oh, wait a minute. No, it's not. It's a supportive system. So in German New Medicine, we don't disregard the immune system, all in the intricate workings of this immune system that we have, but we don't call it an immune system. We call it a support and recovery system.
Mm-hmm.
Support and recovery system, SARS.
Oh.
The real SARS. The support and recovery system is the immune system. And so there is no autoimmune disease. What ridiculous concept to put out there, to say that our immune system would turn on the organism and destroy itself. It seems to be an alien type of mindset, right?
Well, you know what we're talking about now is we're talking about learning a new language.
Absolutely.
Because we have been distilled like we were you know, a cucumber that was going to be pickled and put in a jar, and we've been taught a whole allopathic system of denying symptoms, attacking, squashing symptoms. And now what we're talking about with German New Medicine, the holistic modalities of healing and health, is a whole new way of understanding the language that is irrelevant to allopathy. It's irrelevant to pharmaceutical drugs. It's irrelevant to that methodology. And here we're now talking about the body and a healing system and learning this new language.
Sure.
And the beauty of it all.
It's sacred medicine.
Yes, it is.
Sacred medicine.
Yes. Yeah.
Yep.
Well, did you want to do a brief summary, or do you feel that you've brought us to the close of this?
I think we, yeah, I think we can just close up with just this one last thing, in the sense regarding our learning of GNM, learning of German New Medicine. Be patient with oneself as you learn the new language. Don't get discouraged by the immensity, the magnitude of this work. Work on eliminating some of those old ideas and concepts slowly from your syntax, from your NLP, so to speak, right? And just put those things aside and begin to put the biological lenses on, observing life, observing nature, and allow nature to give it back to you. And it's, again, true freedom. True freedom. And it's coming at such a beautiful time right now. And we don't need anything. we don't need anything other than our truth, the wisdom in knowing where we're at, who we are, and what we are capable of doing. And we'll be stronger, highly adaptable, and yeah, we'll 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 get it done. We'll get it done. And so I look forward to our next talk. And yeah, I appreciate the opportunity, Catherine, that you have given me to share this work and to share what I have come to know over these last 15 years with German medicine. And I very much appreciate you. I'm glad our paths have crossed.
Well, thank you, Chris. I'm ever so grateful and still pinching myself at the opportunity for this.
Yeah.
And
Very good.
it's being brought forward because it obviously is the gift.
It's time.
It's time.
It's time.
Well, until our next conversation, I greatly look forward to that as well. Thank you so much.
Thank you, Catherine.